I did a one-page handout and a couple of minute video on how to use the new problem lists and how to look at them. And providers did read it or look at the education, because several of them I had put in the education that if you notice something that doesn't make sense to you, let me know and we can talk about it. And one of my oncology providers noticed that if he put mastectomy and total mastectomy on a patient's problem list, and a patient had a left total mastectomy and a right partial mastectomy, and when he put those two diagnoses on, they went to two different categories within the categorized view. And I brought this up with IMO, and they took it back probably to Jim and some other physicians at IMO and realized that the mapping needed to be redone. And we have actually gotten that fixed within our system. And now if you put in mastectomy, regardless of how you type in the terminology, they all go to the same category. So IMO has been very responsive to those types of issues when we've found them. And that has been great to be able to take that back to the providers that did bring up the issues with that. That is the only example I've had thus far of something that didn't go to a place that a physician thought it should go. In the future, we are working on re-educate or providing education around problem list again with our onboarding to see so that we can get everybody on the same page with it again, and having IMO Core as a tool to make that cognitive burden of looking at problem lists so much less than what it had been previously is a great way to show providers that we care about the time that they spend with the patients, and helps make those problem lists better for patients overall. I honestly can't recommend IMO Core enough. It's been a great experience, and the providers at the organization seem very happy with it. There's no complaints about it, and anything that we make changes with in IT, as you know, there's somebody that always complains. And so I'm very pleased to have been a part of the initial go live with it, and I'm really looking forward to seeing what more we can do with problem categorization and associated data in the future.